Hello, my friend. Do you know the signs of a stroke? Not the dramatic portrayals, but the quiet signs. These subtle clues, if ignored, can cause irreversible damage. Every 40 seconds, someone has a stroke. Every 3.5 minutes, someone dies from one. Don't miss the warning signs. Recognizing them is key. This information could save your life, or someone you love. Knowledge is power. Be prepared. Strokes are often perceived as a distant threat, but this creates a dangerous blind spot, especially as we age. A stroke is a brain attack that operates with terrifying speed. It occurs when blood supply to the brain is interrupted, depriving brain tissue of oxygen and nutrients. The most deceptive aspect of strokes is their subtlety. Subtle signs like a clumsy hand, unsteadiness, or fleeting numbness are easy to ignore, but can be critical. The golden hour is critical in stroke care. Treatment within the first hour dramatically increases chances of recovery. Time lost is brain lost. Understanding the threat of stroke is about equipping yourself with knowledge, transforming worry into vigilance. Recognizing a stroke early can mean the difference between life and death. Think of it like fire safety. We learn what to do if one occurs. By learning the signs of a stroke, you create a mental action plan. This knowledge is universally important. This is an act of care for yourself and your community. You are about to become a vital link in that chain of survival. Let's discuss a key warning sign that's often missed. Sudden weakness or numbness on one side of your body. Imagine struggling to grip your coffee cup or noticing your leg dragging. This can also affect your face, causing tingling or drooping. Don't dismiss it. This is your brain signaling for help due to lack of blood flow. Remember, asymmetry is key. One-sided weakness demands immediate medical attention. The second hidden sign of stroke is a sudden, baffling difficulty with language, either speaking or understanding. Imagine knowing what you want to say, but your words come out jumbled or as gibberish. Or you hear someone speak, but their words make no sense. This is called aphasia, a direct result of a stroke affecting the brain's language centers. It can strike without warning, even if you feel fine otherwise. If you or someone else suddenly can't speak clearly or understand speech, don't dismiss it as confusion or embarrassment. This is a red flag, an urgent signal that the brain is under attack. Immediate medical attention is critical to preserve the ability to communicate. The third hidden sign is sudden vision trouble. Loss of vision in one eye, double vision, or a sudden blackout in part of your sight. These changes are abrupt, not gradual, and painless. The problem isn't with your eyes, but with the brain's visual processing. For example, losing sight in one half of your field of vision is a classic stroke symptom. Don't wait or assume it's an eye issue. Sudden vision loss is a medical emergency. Time is critical. Seek help immediately. Quick action can save your sight and your life. The fourth sign is a sudden, severe loss of balance or coordination. You might feel dizzy, unable to walk straight, or as if the world is spinning. This isn't mild lightheadedness. It's a dramatic, incapacitating loss of equilibrium. If you suddenly can't stand, walk, or control your movements, especially with nausea or vomiting, suspect a stroke. Don't try to walk it off or rest. This is your brain's alarm. Get emergency help right away. Fast action can prevent permanent loss of mobility. The key to recognizing stroke is suddenness and asymmetry, symptoms that appear abruptly and affect one side of the body. Weakness, numbness, vision loss, or facial droop on one side are powerful clues. Even if only one symptom appears, it's enough to act. Don't wait for more signs. A single, sudden neurological change is a medical emergency. Remember, sudden weakness, confusion, vision trouble, or loss of balance, especially on one side, demand immediate action. Recognizing these signs can turn a bystander into a lifesaver. Quick recognition and response are the keys to survival and recovery. In a crisis, use the FAST test to check for stroke. F is for face. Ask the person to smile. Look for drooping or uneven movement on one side. A is for arms. Ask them to raise both arms. Does one drift downward? S is for speech. Listen for slurred or strange speech. T is for time. If any sign is present, call emergency services immediately. Don't wait or second guess. Every second counts. FAST is your tool to spot a stroke and save a life. After checking the face, we move to the second letter in our acronym. A stands for arms. This part of the test checks for that other common sign we discussed. Sudden, one-sided weakness. Just like the face test, the arm test is a simple physical command that can reveal a profound neurological problem. It is designed to make any hidden weakness in the limbs obvious and undeniable. The procedure is straightforward, and can be done with the person either sitting or standing, as long as they are stable. You are looking for a difference in how the two arms behave, another test for that crucial element of asymmetry. Here is what you do. Ask the person to raise both of their arms straight out in front of them, as if they are holding a large pizza box with their palms facing up. Then, ask them to hold that position for about 10 seconds. If possible, ask them to close their eyes while they do this. Closing the eyes removes visual feedback and makes the test even more sensitive, as the person has to rely solely on their brain's sense of body position to keep their arms level. Now, you watch them carefully. In a person who is not having a stroke, both arms will remain held up at the same height, steady and strong. What you are looking for during these 10 seconds is any sign of a downward drift. Does one of the arms slowly start to sink? Does it sag downwards, unable to maintain the same height as the other arm? Sometimes the affected arm may not just drift down, it might also turn inward, with the palm rotating to face the floor. This happens because the weakened muscles cannot fight gravity or maintain their position. This downward drift is a very reliable indicator of one-sided weakness caused by a stroke. The person may not even feel it happening, especially if their eyes are closed, but you will be able to see it clearly. This arm drift is a powerful confirmation. If you have already seen facial drooping, and now you see one arm drifting down, the case for a stroke becomes incredibly strong. It shows that the weakness is not isolated to the face, but is affecting the entire side of the body. Even if the face test was normal, a positive arm test on its own is a major cause for alarm. It is a clear signal that the brain's control over the body's motor functions has been compromised. You have gathered your second piece of critical evidence. There is no need for further tests or observation. The time for waiting is over. Now we arrive at the third letter of the FAST acronym. S stands for speech. This step is designed to check for aphasia, which is the sudden difficulty with speaking or understanding language that we identified earlier as a hidden sign of stroke. The brain's language centers are highly specialized, and any disruption to their blood supply can have an immediate and noticeable effect on a person's ability to communicate. The speech test is a quick and effective way to determine if this vital function has been compromised. It involves asking the person to perform a simple verbal task that really should be effortless under normal circumstances. The test itself is very simple. You ask the person to repeat a simple, common sentence. It does not need to be complicated. A phrase like, "The sky is blue in Boston," or "You can't teach an old dog new tricks," will work perfectly. The key is to choose a sentence with a few different sounds and a clear structure. As they attempt to say it, you must listen very carefully, not just to the words they say, but to how they say them. Is their speech slurred, as if they are intoxicated? Do they struggle to find the right words, or do they use incorrect words in place of the correct ones? Listen for the quality of their language. Is the sentence jumbled or nonsensical? Can they even speak at all? Sometimes the person may understand your request but be completely unable to produce any words in response. Alternatively, you can test their comprehension by giving them a simple one-step command, such as, "Point to the ceiling," or "Show me 2 fingers." If they look at you with a blank expression or are unable to follow the simple instruction, it is a sign that their ability to process language has been affected. This is just as serious as slurred speech. If the person fails this test, if their speech is slurred, strange, or absent, or if they cannot understand you, you have your third and final piece of evidence. You have now checked their face, their arms, and their speech. A failure in any one of these categories is a strong indicator of a stroke. If you see abnormalities in 2 or all 3, the probability is extremely high. You do not need to be a doctor to make this assessment. The FAST test gives you the confidence to recognize the emergency for what it is, and that leads us to the final and most important letter in the acronym. This brings us to the final most critical letter in the FAST test. T stands for time. This letter is different from the others. It is not a test, it is an instruction. It is the action you must take immediately if you have observed a failure in any of the previous 3 steps: face, arms, or speech. Time is the most crucial element in surviving and recovering from a stroke. Every single second that passes, millions of brain cells are dying from lack of oxygen. The damage is progressive and after a certain point irreversible. The T reminds us that this is a race against the clock, and we must act with absolute urgency. If you see any of the signs, a drooping face, a drifting arm, or slurred speech, the time has come to call your local emergency number immediately. In the United States and Canada, that number is 911. Do not hesitate. Do not second-guess yourself. Do not wait to see if the symptoms improve or go away. They might in the case of a transient ischemic attack or TIA, but you have no way of knowing that. And a TIA is often a warning sign that a major stroke is imminent. You must always treat these signs as a full-blown stroke in progress. The risk of waiting is far too great. When you make the call, be clear and calm. Tell the dispatcher, "I believe someone is having a stroke." Use the word stroke. This will signal to them the severity of the situation and ensure they dispatch the appropriate medical response. Then, use the information you gathered from the FAST test. Say, one side of their face is drooping, or they can't lift their left arm. Also, and this is very important, make a note of the exact time you first noticed the symptoms. This information is vital for the medical team, as it helps them determine which treatments, like clot-busting drugs, the person may be eligible for. The effectiveness of these treatments is entirely dependent on a strict timeline. Remember, T is for time to call for help. It is not time to call a friend, not time to look up symptoms online, and definitely not time to try and drive the person to the hospital yourself. Paramedics can begin life-saving care the moment they arrive. They are trained to stabilize the patient and can transport them to the most appropriate hospital, often a certified stroke center, much faster and more safely than you can. By making that call, you are activating a chain of survival. You have done your part. You have recognized the signs, and you have initiated the professional medical response that gives the person the very best chance at a good outcome. We have talked about the signs to look for. Now let us understand what is actually happening inside the body during a stroke. A stroke is a brain attack, like a heart attack, but in the brain. It occurs when blood flow to the brain is interrupted, starving brain tissue of oxygen and nutrients. Think of your brain as a city, with blood vessels as roads delivering supplies. A stroke happens when those roads are closed, instantly cutting off brain neighborhoods. Brain cells are fragile and begin to die within minutes of being deprived of blood. It's a plumbing problem with devastating consequences. A stroke is an interruption of blood flow, which can happen in two major ways. The most common type of stroke is an ischemic stroke, accounting for nearly 90% of all cases. This happens when an artery to the brain becomes blocked by a blood clot, stopping blood flow. These clots can form in two ways. A thrombotic stroke, where a clot forms in the brain or neck arteries, often due to atherosclerosis. Or an embolic stroke, where a clot forms elsewhere and travels to the brain. Regardless of how the clot formed, the result is a sudden blockage of a cerebral artery, jeopardizing brain tissue. Treatments focus on removing the clot and restoring blood flow as quickly as possible. Hemorrhagic stroke, the second major type, accounts for about 13% of all strokes but is often more deadly. The problem isn't a blockage but a rupture. A blood vessel bursts and leaks blood into the brain tissue, damaging it in two ways. It starves an area of blood, and the pooling blood compresses other areas. There are two main types: intracerebral hemorrhage, bleeding within the brain, often from high blood pressure, and subarachnoid hemorrhage, bleeding between the brain and its covering, frequently from a ruptured aneurysm. Symptoms can be similar to ischemic stroke, but hemorrhagic stroke is more likely to include a severe headache, nausea, and rapid loss of consciousness. Because the cause is a bleed, not a clot, treatments are completely different. Let's focus on the microscopic events after blood flow stops. This explains why time is so critical. Within seconds, brain cells in the affected area are catastrophically damaged, creating an ischemic core. Surrounding this core is the penumbra, an area of at-risk tissue. The penumbra represents salvageable brain tissue and is the focus of emergency stroke treatment. The scariest part? There's often no pain because the brain lacks pain receptors. The arm goes weak, the speech becomes slurred, but there is no sharp warning. People delay seeking help, while the cells of the penumbra are dying. Every minute without restored blood flow, the ischemic core expands. The resulting disability maps to the lost brain tissue. This makes it clear why FAST is so important. We've explored strokes. Now, who's at risk? Understanding risk factors empowers us to take proactive measures. Modifiable risks like high blood pressure, diabetes, and high cholesterol directly impact your cardiovascular system. High blood pressure damages arteries, increasing stroke risk. Diabetes damages blood vessels, accelerating atherosclerosis. High cholesterol leads to plaque buildup, narrowing arteries. Manage these conditions through diet, exercise, and medication to significantly lower your stroke risk. Daily lifestyle choices profoundly shape your stroke risk. Tobacco use is most significant. Smoking damages blood vessels and raises blood pressure. Dietary habits matter. Limit saturated and trans fats, cholesterol and sodium. Embrace fruits, vegetables, and lean proteins. Physical inactivity is a risk. Moderate activity helps. Excessive alcohol raises risk. Moderation is key. Daily choices shape your future health. Some risk factors like age, genetics, and history can't be changed. Stroke risk doubles each decade after 55. Family history matters. Stroke risk is higher if a close relative had one. A prior stroke or TIA also elevates risk. Certain populations like African Americans face higher stroke risks. Knowing these factors helps you manage controllable risks and advocate for your brain health. Strokes don't just happen to those with health problems, sometimes they seemingly come out of nowhere. Surprising triggers remind us vigilance is important for everyone. Stress, temperature changes, dehydration, and even medications can increase risk. Listen to your body and take neurological symptoms seriously. After reviewing this long list of risks, from high blood pressure and diabetes to stress and genetics, it would be easy to feel overwhelmed or even fatalistic. You might look at your own health profile and feel a sense of anxiety, but that is not the purpose of this knowledge. The purpose is empowerment. You are not a passive bystander in the story of your health, and you are not defined by a list of risk factors. You are the protagonist. Understanding your personal risk profile is the first step toward creating a concrete action plan to protect your brain for the years and decades to come. It allows you to move from a place of worry to a place of proactive control. The first step in taking control is to know your numbers. This is a non-negotiable foundation for stroke prevention. You must know your blood pressure, your cholesterol levels, both LDL and HDL, and your blood sugar or A1C levels if you are at risk for diabetes. These numbers are the key performance indicators of your vascular health. You cannot manage what you do not measure. Schedule regular checkups with your doctor and have an open conversation about your specific numbers and what they mean for your personal stroke risk. This data is your roadmap, showing you exactly where you need to focus your efforts. Once you know your numbers, you and your doctor can create a personalized prevention plan. If your blood pressure is high, the plan might involve dietary changes to reduce sodium, along with medication. If your cholesterol is elevated, it might involve increasing your fiber intake and starting a statin. If you smoke, the single most impactful action you can take is to create a plan to quit. This plan is your strategy for systematically addressing each of your modifiable risk factors. It is a partnership between you and your healthcare provider, a collaborative effort to fortify your body's defenses against a stroke. It is about taking small, consistent, and deliberate steps in the right direction. Ultimately, knowledge of risk is only powerful when it is paired with action. It is about transforming I should into I will. It means choosing the salad over the fries, taking the stairs instead of the elevator, going for a walk even when you don't feel like it, and taking your prescribed medications every single day. These are not small, meaningless actions. They are powerful acts of self-preservation. You are actively building a healthier, more resilient vascular system. You are not just a statistic in a high-risk group, you are an individual who has the knowledge and the power to change your trajectory and give yourself the best possible chance of a long, healthy, stroke-free life. Now, what to do after identifying a potential stroke? Call emergency services immediately. In the United States and Canada, this is 911. Do not delay. State clearly, I believe someone is having a stroke, and give your location. Relay the signs you observed using the FAST framework. Note the exact time that the first symptoms appeared. This is critical medical data. Do not drive the person to the hospital yourself. Wait for the professionals to take over. While waiting for emergency services, your role is to provide support and reassurance. The person is likely confused and frightened. Your calm presence can be a powerful anchor. Stay with them to provide a sense of safety. Speak in a calm, reassuring voice. Tell them help is on the way. Use simple, clear sentences. Even if they cannot respond, assume they can hear you. Hold their hand if it comforts them. Help them into a comfortable and safe position. The best position is often lying on their side with their head slightly raised. Lying on their side helps keep their airway open. Avoid letting them lie flat on their back. Do not give them anything to eat or drink. Do not give them any medication. Leave all food, drink, and medication to the medical professionals. While waiting for paramedics, unlock the front door if possible, and secure any pets. Clear a path for the stretcher, and gather medication lists or wallets if readily available. Note any changes in symptoms to report clearly to the paramedics upon arrival. Do not let the person sleep or be talked out of calling for help. Stay calm, and never drive them to the hospital yourself. By taking these steps, you maximize their chance of survival and recovery. I want to commend you for investing this time in your health. Knowledge is our most essential form of protection. The information we have covered today, the FAST test, is now a permanent part of your mental toolkit. Now, you understand the subtle signs of stroke. You have moved to one of active vigilance. This preparedness is a gift you give not only to yourself but to everyone in your life. You have become a guardian, a watchful presence in your community. Therefore, let this be the beginning of your advocacy. Send a link to this video. This is how we combat stroke, with shared knowledge. As we conclude, remember aging well is an active process. You've armed yourself with crucial information about stroke. Time lost is brain lost, and you now have the power to save those precious minutes. Save this video, revisit it, and use it to start conversations. Send it to those you care about. By sharing, you're saying, your life is important to me. One share can genuinely save a life. Stay informed, build a supportive community, and let's learn and grow together. Thank you for your time. If you learned something, please like this video. Share your experiences in the comments below. Take care, and I'll see you in the next video.